Hi everyone, this is again Nurse Practitioner Board Certification Review Courses. Again, my name is Dr. Famous Favor, and I'll be taking you today fetal alcohol syndrome. So it's just a very quick one. Fetal alcohol syndrome has a prevalence of 1/3 of all infants born to female with alcohol use disorder. So we're just going to look at the signs, which include low birth weight, height, macrophthalmia, short palpebral fissure, mid-face hypoplasia, smooth or short philantrum, and thin upper lip. So just a quick way to remember using two acronyms or two mnemonics is either you use the face mnemonic. So FACE. So face, you see all those facial abnormalities. So what are you going to see? What are those abnormalities you can see? The smooth philantrum, the thin upper lip, the mid-face hypoplasia. Then another thing you'll be looking for is attention deficit. So this patient is going to have a cognitive impairment, learning disability, executive dysfunction. C, cardiac defect. So they're going to have congenital heart anomalies, increased risk of cardiovascular issues. And finally, I, which is eye abnormalities, E, the short palpebral features, macrophthalmia. So you can also use the mnemonic fast baby. So whatever works for you, fast baby face. So for fast baby, F is the facial abnormalities, the same thing we have gone through before. But I would like to emphasize on this smooth philtrum and also the thin upper lip. So in your exam, you are going to look at what you are asked. So this patient is going to present with thin, not thick. It's a thin upper lip. And you see in their brain abnormalities, they are going to have microcephaly, small microcephaly. And they're going to have growth restriction, low birth weight. And when you talk about this acronym, if this one is more convenient for you, you can use that. Fast baby, facial abnormality, A is attention deficit, S is short stature. Then you have your B. B is brain abnormalities. A is anomalies of heart defect, and B is behavioral difficulties. So you can use this, or you can also use the previous mnemonics, which is the face. So, but take note that with this patient, everything is going to be small. It's going to be small. It's going to be there's going to be poor development. So that is the emphasis. Small and also poor development. So what is the diagnosis and the management? Patient is going to you're going to do a clinical diagnosis based on this dysmorphic facial features. So those facial features that we mentioned, you can see it is really obvious on the patient. There is no specific cure, but early intervention with speech therapy, special education, and behavioral support is very important. So, how do we prevent this? It's simple: avoiding alcohol during pregnancy. So, this is a clinical case. 4-year-old present to the pediatric clinic for developmental assessment. The child exhibits buzzword growth restriction. Remember, we said everything is slow in this patient. So even their growth, their development is slow. So growth restriction, low birth weight, small stature. So look at this and pay close attention. So patient is going to the development to be very slow, undeveloped. Okay, on examination, you see a distinct facial features including smooth philtrum, tiny upper lip, and short palpebral fissure. So if you want, I know another easy acronym you can use or mnemonics you can use here is just to write the 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 smooth philtrum, the tiny upper lip, and the short palpebral features. That is very, very must know. The mother reports a history of alcohol consumption during pregnancy, raising concern for fetal alcohol syndrome. Further evaluation reveals cognitive impairment, hyperactivity, and poor impulse control, supporting the diagnosis of fetal alcohol syndrome. So, this patient is going to be referred for early intervention services, including speech therapy and behavioral support. So, this is the reference.